because there is a lot to go through, I think it's probably going to be useful to have a little break, just to have a bit of a comfort break. And then we'll go into 4 lessons learned from this project. And then I'll finish up with some conclusions. So just to try and make it a little bit more interactive, I have added some discussion questions throughout the presentation, just to get people discussing the topic at hand as well. But also it would be useful now, if you all don't mind, maybe putting into the chat what your profession is. So if you're a pharmacist, a doctor, a nurse, that would be useful to know. Just be great to know who's on the session today. So it would be great to hear if you're a doctor, a nurse, a pharmacist, or anything like that. If you could put that into the chat, that would be helpful. Also, if you have any questions, you can put them into the Q&A box, and I will get to them at the end or at some point during the presentation. So I hope you all can hear me. I'm not seeing any indication that you can't hear me, so I'm assuming you all can hear me. Okay, hello, Health Plus pharmacists. We have some pharmacists in the house. Thank you, that's good to know. It's great to see that we have some pharmacists in the house. Great, so you're based on the Bay, right? Okay, wonderful. So if anybody else wants to put in, if you're a nurse, a pharmacist, a counselor, a doctor, anything, that would be helpful just to know who's in the room right now. Okay, so I'm gonna get started. So who are we? So Lake Health and Wellbeing, we are a nonprofit based here in St Kitts. We are about 3 or 4 years old now. And what we do is we focus on improving the health and well-being of our local, so that's St Kitts and Nevis, regional and online community. And we do that through campaigns. Right now, you may notice that we have a campaign ongoing called You're Sweet Enough. We do events, health awareness events, so events like this. Public health interventions, and then we also offer public health services to small organizations, and we conduct research. So today we're focusing on one of those research projects, which is understanding the experience of women in St Kitts and Nevis who are living with fibroids. And this project was a collaboration between ourselves and an organization called Soca Girls Rock. They provided a small grant for us to conduct this project. And then we also collaborated with Sarit Brown Research and Consulting, and they were provided some research advice for us for this project. So just a quick reminder that fibroids are benign tumors that develop in or on the surface of the womb. They affect approximately 80% of Black women, but studies suggest that most women with fibroids are asymptomatic. But although fibroids are very common, they receive very little attention. So that's why we wanted to carry out this research project. So the aim of the project was to understand women's experiences of fibroids, and we were looking purely from the patient's point of view. So literally, this isn't like a clinical point of view, this is purely from the patient's point of view. And we also wanted to describe any challenges that women with fibroids may experience that may impact their health and well-being. And we wanted to identify any support needs so that these can be addressed later on. So what we did was last year, carried out in-depth explorations of 11 women's experiences of fibroids. These women were from St Kitts and Nevis. They were aged 23 to 49 and the average age of 39. And we conducted one-to-one interviews, quite in-depth interviews. Some of the interviews lasted for almost 2 hours. And these interviews were transcribed. We created little transcripts and we analyzed the transcripts, and we prepared a report of our findings. And I'm just going to summarize just a snapshot of some of our findings, which and we just selected pieces of information that we think would be useful to healthcare professionals. So the first thing that we did was we looked at disease identity. So how did women with fibroids label their condition? And what we found was that women labeled their fibroids in 2 ways. They gave fibroids a physical identity, and they also gave fibroids an emotional identity. So if we look first at the physical identity, women described fibroids as messy, severe, uncomfortable, life-threatening, painful. So very kind of strong adjectives to describe the physical identity of fibroids. We also looked at the emotional identity of fibroids. So when thinking about their experience with fibroids, women describe that experience as scary, nerve-wracking, depressing, frustrating, hectic, stressful. So again, very, very strong adjectives to describe, the emotional identity of fibroids. And so I guess the importance of these two pieces of data is that sometimes when we think about fibroids as sort of benign tumors, they're not actually benign when you look at the patient point of view. They are actually causing quite a lot of physical and both emotional distress. So now when we moved on to look at the consequences of fibroids, so looking at how does fibroids impact the lives of women? So what we found was that fibroids impacted every aspect of a woman's life. So their physical health, their mental health, their personal and social life, the professional life, and their finances. And we're going to go through some of these now. So in terms of physical health, what we found were that women described two main sort of consequences. So two main symptoms that were reported by women in the study. First was abdominal pain, particularly during their period, and heavy menstrual bleeding, which was not in itself a shock because these are some common symptoms that we know are associated with fibroids. So abdominal pain and menstrual bleeding. So if we first look at the pain associated with fibroids, I think this may be where, not that they were shocked, but maybe not realizing the intensity of the pain of fibroids. So women describe their pain as severe. And I think almost every woman described their pain as severe. Even if it didn't start out as severe, it became very severe as their fibroids progressed. So I have a few quotes here just to sort of highlight how painful fibroids can be. So women described that, they broke down and cried because of the pain. The pain was extremely painful. It was intense. They were cringing on the floor because of the pain. They were keeling over because of the pain. So this is pain that is very, very significant. And maybe at times we may underestimate the amount of pain that women are experiencing who have fibroids. The pain was so intense, in some cases, women visited the emergency room at the JNF, at the hospital here in St Kitts, quite regularly. Again, I've got some examples here of what women said. So for example, one woman said that every 3 months, I would go to the emergency room to get an injection. And she had done this between the ages of 16 and 38, a huge time frame where she was going to the hospital regularly because of her pain. And she said, I remember the last time I went to the hospital was when I said, okay, I'm taking this out, and that she meant her womb. And then another person said that at the time, whenever I used to have my period, she used to end up at the hospital. Another person saying, I used to end up at the hospital. I used to go to the hospital to take injections, which were like painkillers. So this pain was so intense that it caused women to seek help via the emergency room. Then the pain was so significant, it disrupted women's lives. So for example, women said, this was a particular lady, she was at school, she said, it was so awful, they had to call the doctor in. Somebody else said, the pain is so terrible that I don't want to see anyone, I just isolate myself. And then somebody else said, for the first 2 days of their period, they'd have to lie down, and that there was a period of time where they were absent from work every time they had their period for the first 2 days. And she would actually pray and hope that her period would come on the weekend so that she didn't miss work. So you see, the pain is so significant that it's actually now interrupting women's lives and their quality of life. And then the pain was so significant that some women had to depend on medication. So for example, one woman said, I had to feed on Balaudrin, and if it didn't work, I tried ibuprofen. If that didn't work, I increased the dosage. So instead of taking maybe 600 or 400, I'd take 800, which she's currently taking. And then instead of taking 800, I would take 2. So they're just living on pain medication, increasing the dosage. And then another lady said, she was taking painkillers. They would tell her to take 4, she would take 6, and she felt she was over-medicating. So the pain associated with fibroids, very significant, disrupted women's lives, and also meant that many of them were chronically taking pain medication and even taking more than the recommended dose. So here's where I have a first discussion question. So my first discussion question, so if you feel like you can put any comments or thoughts in the chat, is how do you feel about the intensity of the pain that women described? Did you expect that when it comes to fibroids? Do you expect fibroids to be that painful? And what role can healthcare professionals play in helping women with fibroids manage symptoms like pain? And can healthcare professionals address some of the needs that women with fibroids have raised about fibroid-related pain? So within our work, women said that they wanted more natural ways of managing pain. They wanted to have guidance around what would be the most effective over-the-counter medication to use, what would be the most effective prescription medication. And then from what we felt that maybe there needed to be some guidance on safely managing pain and the pros and cons of chronic use of pain medication. So I don't know if anyone has any thoughts on any of these discussion questions. If you have any thoughts, feel free to share them into the chat, or if you actually want to say something, you can raise your hand and then I can actually bring you up onto the Zoom stage and you can share any comments that you might have. So any comments really on any of the discussion questions? Is the intensity of fibroid pain that was described by the women, was that a surprise to you? Not a surprise to you? No, yes, no. Okay. No, okay, so no comments. So I will probably move on then. Anybody want to respond to any of the pharmacists want to respond around managing pain, fibroid pain? Or any experiences of women coming to you with fibroid pain? Okay. Quiet crowd. Okay. No comments. Okay, so I'll move on then to the next section. But if you have any comments, anything comes to you, feel free to put it in the chat and we can always get to it afterwards. But if you have any questions or any comments about these discussion questions, then feel free to put them in the chat. Okay, so the next consequence was the heavy menstrual bleeding. So women described heavy menstrual bleeding, and that heavy menstrual bleeding led to anemia and fatigue, a lot of discomfort, but also embarrassing occurrences such as bleeding accidents in public and at work. So women described sometimes they would faint because of this heavy menstrual bleeding, because of the anemia. Women described that, this lady was describing that she was in a class and she soiled her seat. So it's creating like a lot of sort of discomforts and really affecting people's lives. And then this other lady said, I could feel the blood dripping out and stuff like that. So I was feeling very conscious. So the heavy menstrual bleeding also, as well as the pain, both of those together are very, very destructive when it comes to women's quality of life and when it comes to their health and well-being. Other symptoms that women described to us as they lived with fibroids was vomiting during their period, circulation and nerve problems, painful intercourse, and high blood pressure. So these are also some other problems that women were experiencing living with fibroids. So you can see there are a wide range of symptoms associated with fibroids, which we may not necessarily appreciate. As well as those symptoms, women also described having fertility challenges. So some women experienced challenges around pregnancy complications, so very difficult pregnancies, postnatal depression, so circumstances where made the difficulties of their pregnancy, the difficulties of their delivery, all the stress around would I lose my baby, all of those kind of came together in one situation to create postnatal depression. So you can see, again, some very difficult situations. Also, several women described that they felt their difficulties in conceiving was due to their fibroids as well. So a range of different experiences as it relates to fertility challenges. So in terms of personal lives, we also looked at how fibroids affected women's personal lives. So the symptoms associated with fibroids, so that's the pain, the heavy menstrual bleeding, the vomiting, all of those types of symptoms really affected women's ability to socialize. All of these things were very disruptive. So it meant that women couldn't do the things that they would like to do or that they normally do. And it disrupted things from what I would say the minor to the major. So it disrupted women's sleep. So for example, women described that they'd have to wake up several times during the night to change their sanitary pads, or they would have to take off their sheets and change their sheets, take a shower, just because they might have had an accident overnight. So it disrupted sleep. Women aren't able to exercise because of some of the symptoms that they're having. It affected the clothes that women could wear. So a lot of women now only could wear black clothes, or clothes because of bloating also, the only clothes that were kind of expandable, affected the chairs they could sit in. So things that we would take for granted, these are the things that women with fibroids are dealing with. It also negatively affected their relationships. So it created tension with their friends, family members, and significant others. So for example, with friends and family, sometimes friends and family didn't quite understand what they were going through. So people might make very insensitive comments, and that would lead to tension. Also, sometimes with women who have children, their children would be very distressed, seeing their mothers unwell or upset or crying because of their fibroid symptoms. So it did create a lot of kind of tension and also distress within the family unit as well. So not only is it affecting the women physically, but it's also affecting their relationships and their daily activities. Fibroids also had an impact on women's finances. So, it's expensive. There's several visits to the hospital, several visits to the doctor that you have to pay for. You have to pay for your medication. You have to pay for your sanitary tabs or your pads. So all of these things are very expensive, or not very expensive, but they add up because you're living with this condition chronically. And so that was creating some financial issues. The cost of surgery, all of the medical care costs associated with fibroids did end up having an impact on women's finances. And I think these two ladies summed it up really quite well. They just said, look, I just want to live a normal life. I feel very restricted sometimes. I won't go certain places because I feel I might mess up the place. I've had many episodes. And then one woman just simply said, it really does disturb your life. So fibroids really does have a significant impact on women's personal lives. But there were some positive consequences on women's daily activities. So for example, some women adopted a healthier lifestyle. Fibroids got them to become more aware of the importance of their health. And in some situations, it strengthened some relationships because going through this health condition together actually brought people together. So it actually strengthened relationships. And in some situations, it led to proposals and relationships being brought back together. And so in some situations, fibroids did have a positive impact on women's lives. Then quite significantly, when we look at professional lives, how did fibroids affect women's professional lives? So we saw that it did have a significant impact and it created significant challenges in the workplace. So we're seeing that because of some of the symptoms that women were experiencing, there were regular absences from work. If women did go to work, because they were feeling so unwell, there was low productivity. Women had some bleeding accidents at work, which ended up being quite embarrassing or making them feel very uncomfortable. And then because of a lot of this, there was tension with colleagues and management. So there was tension because maybe people didn't quite understand their health condition. So there were a lot of tensions around that and people not being very sympathetic and empathetic. And then in some cases, the whole situation led to job losses. So whether women just felt forced out of a job because the situation just wasn't really a very positive one. And so this quote here, I thought also was very powerful, where this lady was saying, when she did go to work, she was unable to function. So she would be there in body, but mentally and physically, she was incapable of doing a lot. So she was just there because she didn't want to lose her job, but she was having a whole lot of pain, very extreme pain. So it did have a significant impact on women's professional lives. And many women, like I said, soldiered on, they went to work because they were just scared that it would impact their career progression, and it would also impact their ability to actually have employment. So that is why they soldiered on and went to work. But whilst they got to work, they were very uncomfortable, very unwell. And like I said, it created a lot of tensions in the workplace. So because of all of what I've just explained around the symptoms, the impact on family life, fibroids also affected women's mental health. So women described feeling a sense of depression, anxiety, fear, high levels of distress and stress. And women felt defeated, confused, overwhelmed, and worried. And, again, some of these quotes describe that. So one woman said it was confusing and it was nerve-wracking, just this whole fibroid situation. One lady said she was very, very scared from what the doctor told her when she was diagnosed. And then another lady was describing when she was diagnosed, she said she took it really quite hard because she was afraid that she wouldn't be able to have children in the future. So you can see that fibroids also had a significant impact on women's mental health. So again, I've got some more discussion questions. So if anybody feels like they would like to participate, so how can healthcare professionals, bearing in mind all of what I've just said, how can healthcare professionals address some of the psychosocial issues created by fibroids? Do you feel this is your role? Do you feel you'd be able to advise women some of the issues around mental health, professional life, social life, finances? Any comments on that? Anybody have any thoughts? No? Okay, all righty, quiet audience. Okay, so no thoughts on maybe some of the psychosocial impacts. Any comments, any questions around that? Okay, so if you do have any questions or comments about that later, feel free to just put it into the chat. Okay, so next we're going to move on to just summarizing. So that is just a little snapshot of the fibroids experience. So from a patient's point of view, fibroids are a serious, mostly chronic health condition that affects every aspect of a woman's life. Fibroids is challenging both mentally and physically, and we believe it requires more attention so that women get the support that they need. So I'm going to move on to two areas now. One is the doctor-patient relationship, and then the next area I'm going to move on to is hospital care. So looking at the doctor-patient relationship, as we did the research, we found some great examples of good doctor-patient relationships. We found examples of where there was good communication between the patient and the doctor having a really good bedside manner, the doctor providing women with all the information they needed to understand their situation and make informed decisions, and then the doctor coming to the situation without any biases or preconceived notions about their patient. And that is very important. I'm going to come to that later. So whether that be biases or preconceived notions about our patient's weight or height, which may impact the way they interact with that patient. And then also the doctor listening to women's concerns and validating those concerns. And we saw a lot of that happening. And then also from the patient point of view, we found that the patients that were able to clearly communicate their symptoms and being very prepared for their first appointment. And all of those led to really good doctor-patient relationships in certain circumstances. And just to give you an example of a good doctor-patient relationship. So this was someone we would describe as a trusted and empathetic doctor. And this is what the person had to say about their doctor. They said, Dr. X was excellent in terms of the bedside manner. One of the things that I liked was that he stayed in touch by apps and phone calls. He was not one of those persons that just gave me the number just for the office. I had his numbers, I was in touch with him. There were times when there were pains, unusual pains, and he was right there to suggest and to help. So that's an example of a really good doctor-patient relationship. They had good communication. The doctor was responsive. She felt very comfortable with him. She felt very comfortable to WhatsApp him, to call him, and he was responsive and able to give advice. So a really good example of a good doctor-patient relationship. But of course, there were some issues that we identified from our research. The first was interesting, was gender. So overall, being that fibroids is a women's health issue, but also it's a very sensitive issue. Some of our research participants felt that female doctors were more relatable, they were more empathetic and more able to understand women's concerns. And so they felt more comfortable with a female gynecologist or female doctor. There were some instances of a lack of trust, just really trusting that the doctor was really putting forward, really working in their best interest. So there was that kind of lack of trust. Does my doctor really care about my personal situation? Am I just a number? So there's that kind of lack of trust in the sense of, is my doctor really working in my best interest? There were women that felt very uncomfortable with some doctors. There was a general feeling of lack of empathy, understanding, and sensitivity in some situations. And that, I think, goes back to just doctors maybe not necessarily understanding the extent to which fibroids affects a woman's life and affects a woman's mental health. And there was some kind of trivializing of concerns around women's symptoms. And I'm going to show you some examples. And then a lot of communication issues. So lack of communication. So no real dialogue with the patient and explaining things. Limited communication, where some patients explain, well, there seem to be a lot of gaps in what was communicated. And then how the information is communicated during like a consultation, the tone of voice, the bedside manner, a little bit abrupt. And then what came up a lot was just a general lack of focus on menstrual health during checkups. So patients kind of feeling that doctors could probe a little bit more and ask a little bit more about women's menstrual health. It seems like that is kind of glossed over, but it was felt that if there were more questions asked about, you know, how are your periods, how painful are they, how heavy are your periods, those kind of questions. And it was felt that that didn't really come up a lot in their checkups, and that might have led to delays in diagnosis because those questions weren't asked. So just some examples of what I was speaking about in terms of some of the issues. So one patient said about the interaction. So this is around, you know, the not feeling comfortable and the bedside manner. So one patient said she was so taken aback by the interaction she had with her doctor. It wasn't the most friendly interaction. And then somebody else said her interaction with her doctor was very abrupt. And then this is just an example of where a patient is describing a doctor trivializing her concerns. So she said, I think maybe my doctor thought I was over-exaggerating the pain that I was under, and he just kept rejecting what I was saying about the pain level. So again, it's that sense of trivializing this pain. And then this is just an example of communication and not enough information being communicated to the patient. So this patient said, you know, I had to pry the information out of my doctor. If left up to my doctor, I don't think the issues I had on my mind would have been discussed. So these are just some of the issues that came up around the doctor-patient relationship and areas that maybe could be improved upon. And I think generally when it comes to women's health issues, we do hear that a lot, that women kind of feel that these types of issues are trivialized. And so this kind of, the research that we've done is kind of aligns with that sentiment of maybe when it comes to women's health issues, these issues are not necessarily taken as seriously as they should. So this is some more discussion questions, but I'm feeling you're not feeling the discussion questions, but I'll ask it anyway. So just some discussion questions around how do we build effective relationships or interactions between healthcare professionals and patients? Do we need to encourage more doctors in St Kitts and Nevis to specialize in gynecology? Although I didn't say it, there was some issues raised around the long waiting times for appointments. And also, do we need to encourage more women to specialize in gynecology because of what I said before about women reporting feeling more comfortable with a female gynecologist? So if you have any thoughts on those discussion questions, please feel free to put them in the chat, or if you want to actually say something, you can raise your hand and then I can bring you up so that you can speak. All right, so hospital care. So overall, what we found was that hospital care was very good for scheduled admissions at the JNF in St. Kitts. So what worked very, very well, and if you work at the JNF, definitely keep this, that initial registration and orientation conversation, I think every single participant who had surgery said that that worked very, very well. So they were warmly welcomed. The whole process around staying at the hospital was explained to them very clearly. They felt very reassured because now they came in with a lot of uncertainty, but then having that kind of registration and orientation conversation really just helped them settle in, understand the process, and really helped them in terms of managing their well-being during the hospital stay. People also like the regular updates and preparation prior to surgery. So nurses would come and say, well, we're going to be doing this now. This is going to happen next. So they were getting a lot of kind of, well, in some cases, regular updates and preparation prior to surgery. Women also described that the nurses and the hospital staff created a warm and supportive environment. And I remember one woman saying right down from the orderly straight up to the doctor, everybody made her feel very warm and she felt very supported. So there was sometimes some good communication and care from doctors before and after surgery. So doctors would come in and explain things, and women appreciated that a lot. And overall, though, there was overwhelmingly a positive feedback about the nurses at the hospital. So the majority of nurses provided excellent level of care. And so if we look over on the right, we can see, you know, somebody says the positive, definitely the nurses would rank high. Somebody said the nurses assigned to me and the nurses' aides and so on and so forth, they were quite kind and generous, sorry. And then somebody else said, I think it was a wonderful experience. I was admitted and the whole procedure leading up to everything was really good. And even after was really good. The nurses were really good and wonderful. I didn't have anything to complain about. And it's interesting because a lot of people said that in the lead up to going to hospital, they were very worried because that they heard of all the negative around the hospital, but they were pleasantly surprised. They all had a very good experience, and they said a lot of it was down to the nurses. So we do have to give kudos to the nurses. But of course, there are always areas of improvement. So where we had most of the nurses providing excellent care, there were just a very small minority of nurses where better customer service is required. There were some circumstances where there was a lack of communication, but this was more around when delays occur. So for example, in this situation, a patient said she was quite lost as to what was happening. It would have been nice if somebody had said to her that they were delayed. So just better communication around delays. Maintaining patients' dignity. So what I mean by that, for example, in this situation, there was a young lady, she was in her gown and, you know, she was out in a public place and people could see her. So she just felt that they could have maybe covered her up. And so she felt, you know, everybody was passing by and seeing her. So that was a little bit of a turn off for her. Another area of improvement, or I don't know if it's really improvement, but there were 1 or 2 patients that just really wanted more contact with their doctor. So they wanted their doctor to maintain contact throughout their hospital stay. And a lot of that is just down to reassurance. You know, I think patients want to see the doctor. They want to know, well, if they haven't seen the doctor, you know, am I okay? Did everything go okay? You know, so there's just that maintaining contact with the patient regularly through the hospital stay. I know sometimes the doctors are very busy, but that kind of checking in with the patient was very, very important. And I know in the previous slide, I had said that there was really good communication between doctors, and in some cases there was really good, and that really helped the patient to really kind of allay their fears, make them feel comfortable. But when they didn't see the doctor, they began to be anxious. And so it's that sort of, I guess, maintaining a good balance around how often should a doctor visit their patient during the hospital. I think it should be every day, but I don't know if maybe doctors get a bit busy and they can't. So that was one issue. There was concern around lack of equipment to make accurate diagnoses. So there was an issue around the ultrasound machine and patients feeling like maybe there was a situation, maybe the ultrasound machine is not as effective in the hospital as it is in some of the private practice. And so there was concern about that. And then there was some concern about having no clear avenue for patients to provide the hospital with feedback. And so there were concern that the patient voice is not always being heard. And then there was also the politics around feedback. So there was concern around people saying, well, you know, if I do give the hospital feedback, they may not take it in the way it was intended. You know, it's intended as positive or constructive feedback, and it may be taken as a political attack. And that's not the case at all, because people felt that there's a lot of politics in St. Kitts and people wouldn't take criticism the way it was intended. So I think maybe there needs to be just a nice clear avenue for patients to be able to give feedback. Another sort of interesting area, which I kind of touched on before, was around if women present at the emergency department. So what was happening was that there are women who have very severe menstrual symptoms that are presenting, going to the emergency room for care. And some of these women are going regularly every month, and some of these women were going before they were diagnosed. So they would be going to the emergency room. But obviously we know the emergency department is not really about diagnosis, it's about treating the issue at hand. So what was happening is that women are going to the emergency room, they're getting treated, they're being discharged, but they're not really being given advice or guidance. No one's saying to them, go and see a gynecologist, or maybe you might have fibroid, or maybe you might have this. And so therefore there's a lot of delays in women actually getting diagnosed if they go through the emergency department. So I think there needs to be more proactive care and advice given in the emergency department for women who attend regularly with severe menstrual symptoms, so that they can get diagnosed quickly. Because what we're seeing is that women are going back and forth to the emergency room, they're having severe menstrual issues, but they're not really being directed to where they can go to get more help. And so they'll just be back the next month to get pain medication, and then the next month. And so they're not really being, their issues are not really being addressed. So that was another issue that came up. So again, some more discussion questions, but I'll skip these because I don't think, but the discussion questions are really, what are your thoughts on the feedback around hospital care, and what diagnostic or patient pathway could be developed for women who frequently present to the emergency room with severe menstrual symptoms? So what could we do to really make that process a bit seamless? So if we can see that patients are coming frequently with menstrual symptoms, can we have some system where a gynecologist could come in or refer them to a gynecologist so that they can actually get their symptoms assessed. Anyway, so moving on to just 3 interesting areas that came up from the study. One was around asymptomatic fibroids, another was barriers to diagnosis, and another is self-care and self-management. So as I was mentioning in the beginning, the statistic is that roughly about 70% of fibroid patients are asymptomatic. And generally speaking, people think, oh, well, asymptomatic, women should be fine, there's no issue. But we had a very interesting case here where a participant had asymptomatic fibroids for about 20 years. So she was diagnosed with fibroids actually very young, in her late teens, and she never had a problem, no symptoms, no pain, no heavy menstrual bleeding, no problem whatsoever. But unbeknownst to her, her fibroids were growing and multiplying. And she developed sudden severe pain one day, 20 years later. And it turned out she had a fibroid that required emergency surgery. And what she said of that situation was, it was bothersome to me to know that I have been going to the doctor all this time and nobody ever told me I was developing more fibroids. That never came up. They just asked me, you have fibroids? And she was like, yeah, I've been hearing that for a while. So what this highlighted was that long-term asymptomatic fibroids can become medically significant, and there's a need for women to be monitored regularly, and then there's need for good communication between doctor and patient about the growth and development of their asymptomatic fibroids, so that a patient has a clear understanding of the situation and what that might mean for their future. So that was an interesting area around asymptomatic fibroids. The second thing that I wanted to mention was healthcare-related barriers to diagnosis. So we identified several barriers to diagnosis. Some of the barriers to diagnosis were patient-related, and some are healthcare-related, healthcare system-related. So I'm not going to talk about the patient-related barriers because this is a session for healthcare professionals. But the patient-related barriers tended to be things like patients just not being aware of the signs and symptoms, delaying seeking help. So those kinds of things were patient-related barriers to diagnosis. But both of these barriers to diagnosis caused women to have to live with their symptoms longer than they needed to be, because there was a delay in them being diagnosed and therefore a delay in them receiving treatment. So I'm just going to go through some healthcare-related barriers to diagnosis. So in terms of healthcare-related barriers, some of these barriers were around perceptions about the patient and their symptoms. So what I mean by that is, sometimes when younger women presented with menstrual symptoms, so very bad periods or heavy menstrual bleeding, sometimes the perception is, oh, okay, she's young, it's just bad periods, it's a women's issue, she'll probably grow out of it. So there was that kind of sentiment around it, only for later on for the woman to be diagnosed with fibroids. If it was an older woman, sometimes what women were hearing was, oh, don't worry about it, it's part of the aging process. You're getting older, your periods are changing. So you'd hear that as well. And then, if, for example, if the woman was overweight, then her symptoms would be down to the fact that she's overweight. It's like, oh, okay, you're overweight, you're changing your periods, could be because you're overweight, so maybe try and lose that weight. So it'd be some of that. Or they might be, oh, you're pregnant, maybe you're pregnant. So then there'll be all of this running around, okay, you're pregnant, or you're young, or you're old, you're overweight. So there'll be all of that that going on. And then that leads to a delay in diagnosis. So I think if maybe women do have severe menstrual symptoms, then there needs to be maybe more of a conversation around, maybe I should check to see whether there's an underlying issue like fibroids or PCOS or endometriosis. Another barrier to diagnosis was if a patient had a negative first encounter with the healthcare system. And so one example of that was where a patient wasn't happy with what a doctor said. She had really bad menstrual issues, and the interaction wasn't very positive. And so she didn't interact with the healthcare system again for another 4 years. So what she said was she literally just sucked up her symptoms for 4 years and didn't go to see a doctor again for another 4 years. So that means her diagnosis was delayed by 4 years and her treatment was delayed by 4 years, and all because of a negative first encounter with the healthcare system. And then the setting, so I've mentioned it before. So if a patient seeks help through the emergency room, there's more likely to be a delay in her getting a diagnosis because they're literally just treating the symptoms. But if she goes to her doctor or a gynecologist first, then the diagnosis is probably going to happen very quickly. And an example of that is there was a patient participant who said she had menstrual symptoms, she went to her gynecologist had an ultrasound scan in the office, so she was diagnosed pretty much almost the same day. But that wouldn't happen in the emergency room, or at least not in the situations that we went through in our research project. So in terms of what would facilitate a prompt diagnosis from what we found was that if a patient is first seen by a GP or gynecologist rather than at the emergency department, she's more likely to have a quicker diagnosis. If the doctor or the gynecologist takes prompt action when menstrual symptoms are reported, and also if they have easy access to diagnostic tools. So in the case of the gynecologist having like an ultrasound scan right there, that's really easy. But if the doctor, if it's a general practitioner, doesn't have a diagnostic tools, then having a seamless and quick referral process from the general practitioner to a specialist doctor is also key. So for example, in one situation, the general practitioner just wrote a referral for the patient, and the same day that patient went to a radiologist, the radiologist was able to fit her in, and she was diagnosed pretty much very quickly. So I think all of that can lead to a faster diagnostic process. So in terms of addressing the barriers to diagnosis, so there can be several barriers to diagnosing fibroids. Some of these barriers are patient-related, others are institutional, and these barriers can be addressed through patient education, empowerment, and advocacy. So I haven't really touched on that, but if patients are more aware of the symptoms, more aware of their menstrual health, then we can ensure that they don't delay seeking help and they can receive a diagnosis quickly. If you have a focus on patient-centered care, that can address some of the barriers to diagnosis, and also making the diagnostic process as efficient as possible, regardless of where a patient seeks help. So whether it's in a GP's office, emergency room, or a gynecologist, making that process as efficient as possible can help in terms of addressing any barriers to diagnosis. So the third thing I'm touching on is self-care. And this is just going to be fairly quick because I'm going to touch on it in more detail a bit later on. So what we found was that patients would like guidance on self-care. So they're looking to healthcare professionals to give them evidence-based guidance and advice on the lifestyle changes that they can make that may improve their symptoms and their health and well-being. So that's things around diet and exercise. They're also very interested in herbal remedies and more natural ways of managing their symptoms. And they're looking for remedies that are culturally relevant. And the reason for this is that they want to be empowered. They want to take control of their health. So they're looking to healthcare professionals to give them this type of advice, and they're not always able to get it. So this lady was saying, well, because she couldn't get self-care advice, she went online, and mostly what you find online is American-based self-care tips, and she would like more Caribbean-based Caribbean-based self-care tips. So, so just to highlight the need for culturally appropriate self-care advice for women with fibroids, but I'm sure women who are experiencing other women's health issues. So at this point, I was going to say we should take a break, but as we're making good time because there's not much discussion, we could soldier on. So I am going to just focus now on some of the lessons learned to improve the well-being of women with fibroids. So these are some of the lessons that we learned around what are some of the things that could improve the health and well-being of women with fibroids, but also women with other health issues and other gynecological issues. So the first lesson that we learned was the power of social connection. So what we found was that living with fibroids can feel very isolating, and women can often feel misunderstood, they can feel alone, they can feel like nobody understands them, but it need not be so. Some women felt empowered and happier when they were connected with other women with fibroids, and in a sense, they kind of started to form a bit of a fibroid sisterhood. They felt informed and empathetic friends and family. So if they connected with informed and empathetic friends and family, and I stressed informed and empathetic friends and family for a reason, because sometimes friends and family if they're not informed, if they're misinformed, they can actually cause more harm than good. So they can perpetuate myths and misinformation. And also, if women were connected to trusted and empathetic healthcare professionals, they also felt empowered and happier. So I guess what we need to do is start to try and create opportunities for women with fibroids to connect with each other. And so those are one of the things that we're hopefully going to be doing at Lake Health and Wellbeing, is to try and see if we can form some fibroid support groups and information sessions that bring women with fibroids together, because this will create a powerful support system, you know, having that support from somebody that's been through what you've been through. And this is just an example of where a lady had connected with other women with fibroids, and it was just like a revelation, like to her, you know. She was like, you know, women were saying, I have that too, you know, and it was just helpful for the fact that women, she said, it was just helpful for the fact that there were other women who were talking about having the same issues and suffering through the same things, and it was where they shared information. So there's a powerful support system in bringing women together who are going through similar situations. Okay, friends and family. So friends and family can provide an important support system for women with fibroids. So within our study, when we were exploring this issue, we found that friends and family can become very powerful advocates. So for example, they can empower women to take action. Friends and family, often they sometimes highlighted that something was wrong, even when women didn't realize it. And they also encouraged women to make an appointment with their doctor. So they really encouraged women to do that help seeking. And they also can provide emotional and practical support. And here is just an example of an informed and empathetic friends and family. So this is a patient's cousin. So she said, look, if my cousin didn't say anything to me, she was doing medicine at the time, so she was informed, I would not have gone to the doctor to find out what was happening with my period. So it was that encouragement from her cousin that really helped her actually get to the doctor and get her diagnosis and get her to the bottom of why her periods were so painful. So like I said, friends and family can be an important support system, but they need to be informed with accurate and reliable information. And this avoids the perpetuation of myths and misinformation that aren't helpful, because there's a lot of that going around. It also helps to address any stigma associated with fibroids if friends and family are informed. And it also allows friends and family to provide more sensitive and effective support. So the solution is that when we're dealing with fibroids and women with fibroids, we need to include family and friends in any fibroids education discussion so that they are aware of what's going on, so that they can properly and appropriately support their family member. So staying connected to healthcare professionals is also important. So like I mentioned before, that doctor-patient relationship is key. So a good doctor-patient relationship, from what we have found with our interviews with women, if women had a good doctor-patient relationship, it enabled them to more effectively and pleasantly navigate their way through the experience and make informed decisions. So having access to nurses as an information resource and for support was also found to be very empowering. And in our work, women had informal support from nurses. So what I mean by that is there were women that had friends that were nurses or family members that were nurses, and these nurses were able to give them information, support, and that was very empowering. So it's, in a way, we need to almost duplicate that, so that maybe women who don't have a friend that's a nurse still has access to a nurse that can give them that information and support. I think also being able to get pain management advice, because that was one of the biggest challenges that women experienced, was the pain of fibroids. So being able to get pain management advice from a pharmacist or a doctor, I think would be very useful. And also having access to counselors so that women can build resilience and coping strategies would also be very empowering as well. So having that connection to a wide range of healthcare professionals, I think would be very helpful in terms of improving women's health and well-being. So the second lesson that we learned was the power of the patient taking control of their health. So women described that fibroids sort of took control over their life. So it affected everything, like I mentioned in the beginning, from the clothes they could wear, from the chairs they could sit on, from their ability to go to work and function. So it affected every aspect of their life. But women can, to a certain extent, can take some of that control back, and that could be done through holistic self-care and through effective self-management. So self-care, self-management, sometimes are used interchangeably, but we decided to separate self-care and self-management into two distinct things. So self-care is the decisions and actions taken independently of healthcare professionals to better manage day-to-day challenges and improve well-being. And so what we found was that women living with fibroids who had the information and tools to practice self-care felt empowered, and this in turn improved their well-being. But what we are finding is that the self-care needs to be holistic, so it needs to cover every aspect of their life. And healthcare professionals can play a role by providing evidence-based self-care guidance. So I'm going to go through some sort of a framework around holistic self-care. And these self-care concepts have been developed by Wright State University, or described by Wright State University in the US. So physical self-care. So this is ensuring that women understand how to manage their fibroid symptoms. So the lessons that we learned from our research is that women want to understand the lifestyle changes they can make, the pain management decisions that they can make, and herbal remedies and home remedies that they can try to help with their symptoms. So these are some areas that we need to focus on. Emotional self-care, that's managing difficult emotions. So that's helping women trying to build their resilience, encouraging women to have some me time, because we know that as women, we are busy. We don't focus on ourselves. So it's encouraging women with fibroids to have that me time. It's peer support, so connecting women with fibroids with other women with fibroids, and then counseling, ensuring that women have mental health counseling and are able to see a counselor if they need it. The third type of self-care is intellectual self-care. So women learning about fibroids, understanding what fibroids are, and then learning how to manage them. And that requires reading, researching, women attending educational events. And one suggestion from from one of our participants was for fibroids to be included in some kind of women health check at the clinics in St. Kitts. So these are some of the things is that we need to provide women with the information so that they completely understand their health condition. Then there's social self-care. So this is improving women's ability to interact socially. So you may remember earlier on in the presentation, I was saying that fibroids affected women's ability to socialize and do the things that they normally do and want to do. And so this is about making sure that women still can stay connected within society. So what we found was that women explained that, they kind of isolated themselves, they felt ostracized, they felt forgotten, they felt people didn't understand them. So we still need women to feel part of society, part of the community, not to feel ostracized. So we need to think of things to ensure that we can ensure that women can interact socially. So one of the things that two of the patients did, which I thought was interesting, they had what we call, well, I'm calling a fibroid grab bag or fibroid survival kit. So they had a bag that they took everywhere with them that had a change of clothes, wipes, painkillers. So literally everything that they would need so that they could go through that day without being uncomfortable. So it's employing those types of strategies or giving women that type of advice so they can still interact socially. Then there's occupational self-care. So if you remember earlier, I was saying that fibroids significantly impacted women's ability to work and created some challenges in the workplace. So how can we create a positive work environment and experience? And this requires us to see how we could ensure that women have good communication with their line manager and colleagues so that they can clearly communicate their situation so that there's understanding. But also it requires us to educate employers around this women's health issue so that they could make the reasonable adjustments and be a little bit more empathetic. And maybe we need to also empower women to speak up so that they don't feel like they can't voice that they're not feeling well for fear that they may lose their jobs. Maybe we need to look at policies in the workplace. Are they fibroids friendly and fair? But not just fibroids friendly, but are they just friendly when it comes to women's health issues? Because other women who will have endometriosis, PCOS, but they'll also have just terrible periods. Are the policies in the workplace friendly enough so that women can feel comfortable? And then we may need to encourage women to do some self-advocacy. So advocate for themselves in the workplace. And then finally, there's spiritual self-care. So women drawing on their religious beliefs for inner strength and peace. And this is very important, particularly in St. Kitts, as we're a Christian community. So making sure that women, despite having this illness, can still connect with God, go to church, and do the things that they need to do spiritually to improve their health and well-being. So that's self-care. So now thinking about self-management. Self-management is involves a bit more healthcare professionals. So it's a patient working with healthcare professionals to better manage the day-to-day challenges associated with their condition and being active participants in their own care and management. So actually, this is a partnership between the patient and a healthcare professional. And as we said, a good doctor-patient relationship is key, and having access to well-informed nurses, pharmacists, counselors, dietitians, etc., would be useful in terms of self-management for women with fibroids. So in terms of self-management, the Ministry of Health has a chronic disease self-management program, and it may be that we need to ensure that women with fibroids are able to access the chronic disease self-management program. But in terms of self-management, what we saw is that it needs for there to be effective partnerships with healthcare professionals. So good communication, maybe women having more access to female doctors because they want that empathetic air. Decision-making, so this is shared and informed decision-making. So this is making sure that both women and doctors are both involved in the decision-making around women's health, and it doesn't feel like a dictatorship where the doctor is dictating, but it's a shared decision-making. And that there's also a structured decision-making process so that women are given options. These are the pros, there's the cons of each option, and then they can make an informed decision about whatever care that they would like. The third option, the third self-management technique is resource utilization. And this is around healthcare professionals working with patients to ensure they have all the information and resources they need. And also what was important, what came out was that with fibroids, there's a lot of information out there. It's very hard to understand what's accurate and what is not accurate. And so women do need that support from healthcare professionals to determine the accuracy of information that they're receiving and to validating any resources that they access, because there's a lot of information online and they're having to kind of work their way through, do trial and error. And that's a very difficult process and also time-consuming process. And so they would like to have guidance from healthcare professionals. And then problem solving. So fibroids, living with fibroids, there are a lot of problems that women encounter, and they do need support in terms of navigating all of these problems. So it's about working with patients to address any issues that arise and exploring solutions that meet patients' needs and that patients are comfortable with, because sometimes women are feeling like that some solutions are probably forced on them, so they're not necessarily feeling that comfortable with them. So it's having that kind of almost like the shared decision-making, but the shared problem solving as well. And then lesson 3 is mental health is very important. So like I said at the beginning, the women felt depressed, anxious, overwhelmed. So because of the impact of fibroids has on every aspect of their life. So like I said, it can be very mentally draining. And so we just need to make sure that women have access to counseling. But what we also identified was that because fibroids can be a very sensitive topic, there can still be a lot of stigma around menstrual health issues. There are some women that feel very uncomfortable reaching out for support. So we just need to make sure that those women receive special attention so that they can access support if they need it. And this will prevent women from suffering in silence. And so this needs a proactive approach from NGOs like ourselves, from the Ministry of Health, and from counselors to really try and reach out to women and ensure that they know that there is support for them if they need it. So what we found was that women may need a wide-ranging support. So that's emotional support, practical support, work-related support, peer support, information, patient navigation, so help navigating the healthcare system. And like we just mentioned, self-management and self-care guidance, and then financial support to assist with all the expenses related to fibroids. And I think if we can give women a holistic support system, then we can improve their well-being as they live with fibroids. And then finally, is menstrual health education is very important. So recently, I don't know if you all had, well, you probably did, but if for those of you that might not be aware, recently menstrual health was given a formal definition, and this is in line with the World Health Organization's definition for health. So menstrual health, the definition, I can share it later with folks, but it's quite a long definition, but generally speaking, the menstrual health definition is that menstrual health is a state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity in relation to the menstrual cycle. So, and then it goes through various different areas around the life course that would promote good menstrual health. And I can send this around if people haven't seen it. So mental health education is important. So what we've found from our research project and interviewing women is that our research suggests that women are not aware of what a normal period looks and feels like. So what we think is that mental health education really needs to be part of the education that young girls receive so that females are aware from a very early age of what an abnormal versus normal period looks and feels like. And this will enable women to be more proactive about their menstrual health and also facilitate an earlier diagnosis of gynecological conditions, because women will then be very clear when something isn't quite right. Because I think right now women are normalizing abnormal menstrual symptoms and just living with these symptoms, living with this pain, when actually there is an underlying issue. And that's because they're not aware of what it is for there to be good menstrual health. So we also think women need to be more aware of conditions that may impact their menstrual health. So that would include fibroids, PCOS, endometriosis. And they're also the myths and misinformation about fibroids and other women's health issues need to be addressed with accurate information. There seems to be a lot of misinformation, a lot of inaccuracies out there about some of these women's health issues, and these need to be addressed. And then just finally, just to finish up, the fourth thing that we learned is that there needs to be a lot more empathy around menstrual health issues. So some of the stories that we were hearing about some of the ways that women are treated because of their menstrual health issues, some of the insensitive comments that are made as well. So it just means that we need to do a lot of work in the community to create a more sympathetic, empathetic, and empowering dialogue around menstrual health and women's health in public discourse, in the workplace, and along the whole healthcare pathway as well. So that, in a nutshell, is a summary of some of our findings from our research project. So just to summarize that, fibroids is a significant health issue that affects every aspect of a woman's life. We do think that fibroids require more attention from the Ministry of Health, from public health professionals, from NGOs, so that women are empowered with information and have access to relevant support to manage. And we just think there needs to be more sensitivity and empathy across the board when it comes to women's health issues. And all of this will improve women's health and well-being. So I just wanted to really just acknowledge all the women who took part in this project. They were fantastic. They were very open, very honest about their experiences. So I'd like to thank them. I'd like to thank Dr. Fanta Waterman for her research advice, Natasha Aikens, who's Executive Director of Soca Girls Rock. They provided us with a small grant to conduct this research project. I'd like to thank all our volunteer research assistants. So we had medical students from the University of Medicine and Health Sciences here in St Kitts, and 2 medical students from the University of Exeter in the UK. And they helped us with transcribing interviews and analyzing data. I'd like to thank the staff at the Innovation Hub at the National ICT Center for accommodating us. We did a lot of the research interviews there at their meeting room, and thank the Ministry of Health for giving us ethics approval to do this project. And then I'd just like to thank all of you today for attending. I'd like to thank the St Kitts and Nevis Medical and Dental Association for the opportunity today, and Dr. Pierre as well for all his support and for organizing this session today. So thank you so much for your time. I do hope that this was useful. If you have any questions or comments, please feel free to let me know. You can put them in the comments section of the chat, or you can put them in the Q&A. I think Dr. Pierre is here now, so I don't know, Dr. Pierre, if you have any